Tansei from the traditional territory of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat people, broadcasting from Toronto. My name is Marion Crow, and I am the Chief Executive Officer of the First Nations Health Managers Association, bringing another COVID-19 virtual town hall. And thank you so kindly for welcoming us and getting your information that's always credible and reliable and factual here at the FHMA Town Hall. But more importantly, thank you for welcoming us into your territories, your organizations, your homes. We certainly appreciate that you are watching us and getting your information here. So I just wanted to say that we're going to be taking a little bit of a tiny break after next week. So the first couple of weeks of April, we're going to regroup and then come back with more information for you regarding COVID-19 and vaccines that are being distributed across Turtle Island. So we're going to continue, but just taking a quick pause. Of course, I want to do a huge shout out to the great team who makes all of this happen technically and on the communications front, and that is the information to us in both, so we can have it in French as well. I want to share with
how do you create models where if you have to ventilate 100 patients that happen to have COVID, how do you create all those frameworks and setups? And that was really the first foray for probably close to 4 to 5 months. I'd say from about February. Once we saw what was happening coming through Italy and then through New York, it was a foregone conclusion that COVID was definitely coming into North America, having been in New York, and it was definitely coming into Canada. And sure enough, we had our first case in early March. And so like most hospitals, 4 to 5 months was strictly planned on How do we create all this capacity, train staff, get all the proper PPE in place, get all the equipment in place? How do we set up assessment centers to do testing? What are we going to do to support long-term care homes that happen to have significant outbreaks? And then finally, leading into the last sort of quarter, starting in December, is what are we going to do to manage to help the rollout of vaccines? And so the first phase, and that has continued. Fortunately, I think in Canada and definitely in Ottawa, we have not seen the dramatic outbreaks, so to speak, with large volumes of COVID patients like we've seen with our counterparts south of the border or in Italy. But we have had sort of spikes and valleys of activity. And so that, while we set that up in the first 3, 4, 5 months, the reality is that need to make sure that should we get another wave and we have to surge incredibly, that is always top of mind. So that's kind of the first wave of activity. I think equally as important, the other major piece of work for all hospitals is we still have, unfortunately, a lot of sick people that come to us for care that we have to take care of. And so while we're trying to create models by which we safely and effectively care for COVID patients, we still have patients that have heart attacks and strokes and car accidents and those types of things. So a big chunk of activity has also gone into how do we maintain access to a healthcare system that may be overburdened with the demands of COVID patients. And as I said, in Ottawa, we've been fortunate. We've had no more than 30 to 40 COVID patients at a time in our hospital. As a hospital, it's got about 1,200 beds. That is manageable. If you have 300, it's not manageable. And you start to really impact on what we see in terms of general access to care. And probably the biggest impact we've seen, I think most hospitals across Canada saw this in the early days, is assuming what happened in New York was coming to Canada, we shut down large portions of elective surgical activity to create bed capacity. Now, thankfully, we never needed it, but what it's created is a backlog to catch up on surgical care across many, many surgeries. So we're backlogged somewhere between 15 and 17,000 surgeries that we are trying to run at 110, 120% to catch back up on. Pretty much all hospitals across Ontario are in a similar boat, or at least the large centers that do the bulk of surgery, as well as I think many other provinces are feeling the same thing. In terms of access to surgical care, emergency care, outpatients, we do a lot of virtual care in because we've had to change a lot of our models by which to provide access. That is something that from probably March, when we started closing down elective surgery last March, throughout has been an ongoing focus for hospitals of how we maintain access. And then I think the third and final component that is equally important is the reason hospitals have been so successful in managing through COVID is 100% due to the resilience and the dedication of the workforce. I mean, the reality is that hospitals is very much a people business. What we do day to day as a service industry is driven 100% I think the challenge with that is there are a lot of people that really need the hospital and are sick, and if they don't get the care, their situation can worse from the point of view of either morbidity and or unfortunately mortality. And we've seen a lot of that in Ottawa. We've definitely seen a lot of that across the province and most likely the country. And so for people, like after a year, I can tell you unequivocally, the protocols that we have in place in terms of managing COVID to protect both the staff, the physicians, and most importantly, the patients are really, really strong. We isolate people. You'll see people always in PPE. There's all the proper hand washing and all the practices. But what I say to people that, look, if you're not feeling well, and particularly if you've had a history of any type of illness, and you don't have an option with a family physician or you can't get care in the community, don't create that risk of not coming to hospital for the fear of getting COVID, because the alternative could be worse. And so, in the beginning days when we all started and we didn't know this disease back in Feb and March, granted, all organizations were trying to figure out how to manage this and create an environment that was safe both for patients and for staff and physicians. After a year, those protocols are very sound now. And so it's very safe to come to hospital. And for patients that, particularly the elderly that often have chronic diseases that can be exacerbated and cause significant issues for them, if they're not feeling well, call 911, come to the hospital by family member. If it's not urgent, we're going to get you in and out quickly. If it is urgent, then you're in the right place to be cared for.
I love that message. Thank you so much, Cameron, for sharing your insight and your knowledge with all of our viewers and listeners across Canada. And I understand you were managing all of this. You were appointed as the new president and CEO during all of this. And you were deploying an electronic health record across 3 hospitals and a heart institute, right?
Yeah, it's been a busy year.
Well, Cameron, I salute you and all of the hospital workers caring for our loved ones like we would our own. And it is such a pleasure, Cameron, to be working alongside of you in governing the hospital. So, Miigwech, we so thank you for making the time to join the FNHMA Town Hall today. Much appreciated.
Oh, my pleasure. And thank you for having me here today, Marion.
Well, we'll have you back in April when we go to, excellent. Well, you know me, I will call you on that.
Anytime.
All right. Well, thank you, Cameron.
Have a good day.
You
Bye.
as well. Thanks, Cameron. So we're going to continue on with our broadcast. It was delightful, though, to get a hospital perspective on how COVID-19 is impacting the healthcare environment. I do want to make a note that if you have any questions, we still have Dr. Evan Adams, the Chief Medical Officer for Indigenous Services Canada, no stranger to this town hall. And if you have questions, please send those to fnhma@ihtoday.ca. So we're going to, I'm just looking for if we still have Dr. Adams with us. And if the studio can help me out there, all right, absolutely. All right, so we are going to reconnect with Dr. Adams. We just dropped the connection there briefly. The computer is frozen, so he is coming back on. And Chris, would we happen to have queued the info point information that we can share? Let's get some information while we get Dr. Adams back. We would like to share some more information with you listening and watching this town hall on info point. And I'll shoot this back to Chris in studio. Created by your First Nations Health Managers Association, we introduce InfoPoint, a convenient and accessible helpful desk for First Nations health managers looking for credible sources of information on COVID-19. Don't have time to dig? Talk to a real person now at 1-855-446-2719 or email infopoint@fnhma.ca. Indigenous Health Today is another resource of information by region at ihtoday.ca. Created by your First Nations Health Managers Association, we introduce InfoPoint, a convenient and accessible helpful desk for First Nations health managers looking for credible sources of information on COVID-19. Don't have time to dig? Talk to a real person now at 1-855-446-2719 or email infopoint@fnhma.ca. Indigenous Health Today is another resource of information by region at ihtoday.ca. Thank you so much for listening in with me, everybody, for the information regarding InfoPoint. InfoPoint was something that FNHMA really felt the desire to build right at the beginning of the COVID pandemic. And as we've just landed in that 1-year anniversary, I know I recognized it last week as well, there are so many stories of resiliency shared across our nations, celebrating health workers. I mean, let's reflect back and remembering what March looked like, trying to buy toilet paper, clapping in major cities for all of the healthcare workers across Canada, people that lived across the street from hospitals were banging pots. And it's just been such an unprecedented time. We've definitely had impacts of COVID that will last a lifetime. And I'm sure there's many practices that we're going to take into whatever a new normal is. But in terms of how FNHMA has responded to COVID-19, InfoPoint was one of the very first things that we wanted to ensure that people had safe and credible information and could access it, because health directors were just so overwhelmed with information coming out during those first couple of weeks and that first month. So that was one thing. I do want to share with you too that the First Nations Health Managers Association responded very quickly to adapting all of our certification and our learning tools and modules. So we do now offer a hybrid education model so that we can move forward with teaching in an platform that keeps you safe, keeps us safe, but continues to support you in your growth to professional development. I would also like to give a call out too to VIO volunteers. VIO, if you recall the journey of the past year that we've had, has been on the FNHMA Town Hall supporting nations with masks and PPE. We were so grateful to partner with them in terms of making a large donation, thanks to all the people who watched the 3-hour virtual celebration of health workers and the graduation and awards ceremony. If you haven't had an opportunity to watch that yet, I highly encourage you to check that out. We're still taking donations to support VIO, a nonprofit organization, getting those masks out to nations. If you need them, that's a resource that you can call upon. Of course, we quickly partnered with the Canadian Red Cross as well, who have also been on the town hall sharing how they have been responding to COVID-19 as an organization. For many nations in Manitoba, we saw the deployment of Red Cross volunteers and workers in ensuring that we could get COVID testing, offering PPE, and coordinating with community health and wellness plans as well. And speaking of plans, the FNHMA has a free resource for you. And that resource is the First Nations Pandemic Planning Tool. So if you are interested in getting your hands on the pandemic planning tool, please visit our website. It's a free resource, and we want to support you in making sure that your pandemic plan is up to date. I know folks have a lot of questions regarding all of the vaccines that are coming out. And of course, AstraZeneca is one of those vaccines that people are asking about, especially when we see some European countries who are no longer administering that specific vaccine. But we know that it is recommended by NACI, which is the National Advisory on Immunization. That's the group that is providing the requirements and recommendations on vaccines. The other things that I want to share with you as well is watch in your community health center for when vaccines are happening. We know that vaccines across Indigenous nations are over 500 nations have started their vaccine campaigns. So make sure you check out your health center and your regional health authorities for when you can be vaccinated. And I believe I've got Evan back with me, Dr. Adams.
Hey,
Hi,
can you hear me
Dr.
okay?
Adams. I can hear you great. Thanks for coming back.
Oh, that was so strange. My computer froze in the middle of your last interview. So anyway, I phoned in. You can't see me, but you can hear me.
We love that voice, Dr. Adams, and I'm so glad that you returned. I'm sure people are tired of hearing my voice already. So, Dr. Adams, what can you tell us about where we're at in terms of how many COVID cases are on reserves right now? Is vaccine picking up? What can you share with us, Dr. Adams?
Yeah, you were sharing some of the information that I wanted to share, which is that about 585 First Nations communities have started their vaccinations. Out of a possible, there are about 630 First Nations, and our data on Métis and Inuit is, well, it's not good. We need to do some work on that, so we don't have a clear picture on how it's going in those communities. But we've administered about 200,000 doses for First Nations in our communities, and sometimes in our members who are out of our communities or away from home. The vaccine scene has changed. Probably some of you heard about our production issues that meant that there wasn't a lot of vaccine being able to go out. But now we have about 1 million doses arriving in Canada every week. And we've had some changes so that it's easier to distribute, like some of the cold chain storage isn't as stringent as it used to be. And there are probably now about, let me see, I think over 300 million people in the world have been vaccinated. About 300 million people around the world have been vaccinated. So we're getting a pretty good idea around severe side effects. Of course, the mild side effects you should be expecting. And we can talk about that because I think more of us who've had the vaccine are talking about, oh, how is it for you? And how did you cope? And we're hearing stories about, some people had an easy time and some maybe more a difficult time, in their questions around that. 300 million people are being vaccinated worldwide. It's pretty amazing. And I just have to say that for those people who are still wondering about COVID, like there are some people who still don't quite believe it, that there have been about 120 million cases worldwide, with over 2.5 million deaths from COVID. The actual number, those are the official numbers. The actual numbers are probably higher than that. So there's a lot of reasons, and including about 1,000 First Nations people in our communities who've died. So the total case counts now, like I said, my computer froze, so I can't see the numbers, but I think it's around the 24,000 mark. And just over 400 communities have had clusters or outbreaks. So that's a pretty high number of us. Most of those cases and communities that are affected are in the West, in BC, Saskatchewan, Alberta, and Manitoba. So there's still some activity. The vaccine is rolling out, but still I would say with 200,000 doses administered that we still have a ways to go. So we still have to be careful. And but I am definitely hearing a change in the conversation with communities and their leaders when they talk to us. They're curious about all the different vaccines and their differences. They're starting to hear that some of the younger age groups and some of our city cousins are starting to be vaccinated. They're curious now about young people. They're curious about AstraZeneca, which has a lower efficacy than the mRNA vaccines, and I think people are just talking more about the reality of it. And for those who are, last of all, I'll say before we chat some more, those who are still on the fence, I'm really curious and keen to hear what their concerns are, so I can address them. Yeah.
Well, let's kick off with AstraZeneca, Dr. Adams. I know there are some European countries who are not administering it anymore. What are some concerns about it? I know it's still approved by Health Canada and is recommended by NACI. What can you share about AstraZeneca with us? Well, that's not a lot of sharing, Dr. Adams.
Oh, sorry.
I'm just teasing.
I'm so sorry. I was talking away to myself while I was on mute.
Oh, we gotta laugh and smile.
Yeah.
So tell me about AstraZeneca.
Sure. In Europe, there were 2 cases, a death and an injury from blood clots. And these were after these 2 people had the vaccine. And so some European countries decided to pause, not cancel, but pause to see if these major health events were related to their vaccination. This safety monitoring of the COVID vaccines is the largest safety monitoring we've ever had of any medicine or medical technology kind of in the history of the world. They were being really careful. People do have major health events, and they've been having major health events since before the vaccine. Like people have blood clots with or without, people have blood clots, and we're wondering as well, the possibility is that they would have had those blood clots whether they had the vaccine or not. Since then, another death has been added to that investigation, and so they're checking. But what's really important is that there's no evidence that there's a causal relationship between them, that the vaccine caused this. This was never seen in any of the trials or anywhere else in the world, so that's a bit suspicious. But also the number of blood clots in Europe is not up. You would think that if there was blood clots caused by a vaccine, that the number of blood clots would be higher because vaccination is occurring, and that's not happening. However, we're being really careful and looking at the evidence because people are concerned about vaccine injury, and we want to make sure that that's, that they're not connected. So for me, I worry about talking about these kinds of issues because then it makes people hesitate. It makes them think, oh, maybe it's not safe. Like, do I wait until the end of the investigation? Well, we're going to constantly be looking at these kinds of events to make sure that everything is safe going forward. So that's the story with those with those deaths. People are also talking about AstraZeneca because, now that it's available in Canada, it has an efficacy that's a little lower than the mRNAs, than Pfizer and Moderna. And so some people are saying, oh, why would I take a vaccine with an efficacy in the low 60s compared to an mRNA vaccine that has an efficacy in the low 90s? And that's a really good question that I think we need to talk about, because in some provinces, they're offering it to, say, essential workers or to younger people who are less of a priority than, say, healthcare workers or older people. And so being given a choice between no vaccine or a vaccine that has pretty good effectiveness, because low 60s is still very good. It's still higher than, say, the flu vaccine. And, a 65% reduction in having a serious illness is still a lot better than having no protection against having a serious illness to COVID. But I can see how some people say, I want the Cadillac. I don't want the Chevy. So
we don't want the
talking
Pinto.
The Pinto. I don't even know cars, so I don't even know what a Pinto is. But I think you get the analogy. So I'm curious how people are going to be talking about this. Certainly for some essential workers, who are constantly facing people in the public, they would welcome a vaccine. For younger people who have very low risk of having severe illness, most young people have mild illness if they have any symptoms at all. And I know for many of them, they want to get back to their social circles. So having a vaccine right away, quick, even if it's less effective than another vaccine, is maybe a good option. But I think for others, they're saying maybe I want to try for a higher level vaccine than the one that's currently being offered. So it's interesting. I wonder how your viewers and your audience are feeling.
Well, we still have so many questions, Dr. Adams. I mean, people want to know about variants as well. And, what are the updates on vaccine efficacy on the variants? What kind of information do we have on that from your perspective?
Well, I'm not as up to date on the latest in that.
Okay.
All I know is that we are definitely looking at how effective the current vaccine is against the current strains. We know that the UK variant, that the current vaccine is quite effective against, and that there is some protection against the South African variant. The Brazil variant we're hearing is quite interesting. Like there's data coming in like literally this morning around how are the protections from the current vaccine there, and how much more catchy is the Brazil variant or even the South African variant than the current dominant strain. What's good to know though is that we do have the ability with vaccine technology to adjust the vaccines to have better coverage. Just like the flu vaccine has a number of formulations against the various flu strains. There are lots of different flu strains. So hopefully what can happen is that we develop a booster against emerging variants of concern going forward. But we have the vaccines that we have now. They're pretty effective. Like they're doing better than we had hoped. 94% efficacy for the mRNA vaccines is pretty darn good.
That's amazing. I love that. You know what? Here's a question for you, Dr. Adams. With some provinces deciding to move forward with delaying second doses of the vaccine, so to get more needles in arms, some provinces are saying we're going to stretch that time period to administer the second dose. Does that make the vaccine less effective, would you say?
No, definitely not. And that's because your immunity that you get from the first dose doesn't seem to wane or lessen after 2 months. And we're confident around the 4 months, because even though we don't have direct evidence about your immunity not waning, we do know from other vaccines that the effect of the vaccine normally lasts for quite a long time. Your immunity shouldn't fall away that quickly. It's not like an antibiotic. Some people were saying, well, with antibiotics, you have to take it on time or it's not effective. But with antibiotics, the half-life, or how quickly your body clears the antibiotic, is pretty fast, like 12 hours, something like that. And then there's not a lot of antibiotic in your bloodstream. But vaccines are not like that. The vaccine primes your immune response, like your white blood cells, your immune system, and your white blood cells in your immune system can remember for quite a long time. We don't know how long with the COVID vaccine, but we're fairly confident around the 4, and will last at least 4 months until you get the second dose. Remember, the effectiveness that you get from the first dose is around 80%. And then with the second dose, you jump to about 94%. But if you just do the math, it's better for more of us to have pretty good immunity than for some of us to have perfect immunity. That the disease spreads much, much less if more of us are vaccinated faster with the first dose.
So if we want to get back to whatever our new normal is, I hear what you're saying here. We need to be vaccinated and still following those public health guidelines, right, Dr. Adams?
Yeah, unfortunately, not unfortunately. We do have to just continue to be safe.
Yeah.
I think we're at about, close to 10% of Canadians have been vaccinated. We still have a way to go. So I wouldn't be relaxing my public health measures now. We're definitely saying to people, you still need to do social distancing. You still need to have good hygiene with your surfaces and washing your hands.
Right.
You still need to mask and be careful about visiting. Try and avoid visiting until a little bit later, until more of us are vaccinated.
Here's a question with respect to the two dose mRNA vaccines. Do the 2 doses need to be from the same manufacturer? Or is it possible that you could get your second dose and it's something else? Too technical of a question?
Ooh, those
Good
are
one?
great questions. That's a
Okay.
good one. Yeah, we're definitely looking at crossing over, like from one vaccine to another vaccine. Let's say your first dose is with Pfizer and your second one is with Moderna. Like, can that occur? Is there still the same efficacy or a similar efficacy, or is that just completely not good? So we're checking on that, and we suspect that that you may be able to cross over. We're suspecting that. We're not suggesting that, not by any means, but we're looking. But the plan at the moment, is, your 4-month follow-up booster dose will probably be the same, chances are, as the first one that you got. And there seems to be quite a good supply. Like, it's not like we're going to be forced to cross over. And there's no evidence that switching to a different vaccination for the second dose is helpful. There's no evidence of that yet.
All right. Well, I do have another question for you from the inbox. First, hi, Yvonne. Thanks for watching. And I don't think this is your question, but there is a question. I just wanted to say hi, Yvonne, because I know you always watch diligently, and we appreciate that. Somebody wants to know, Dr. Adams, if they can go for a COVID shot if they have an immune or amnemic disorder. Sorry, it took me a moment to get that word off my tongue.
Sorry, did you say an anemic disorder or low red blood
Yes,
cell count?
if they have an immune or anemic disorder, can they get a
Oh.
COVID shot?
Interesting. So as far as anemia, which is when you have low red blood cell counts, I've not heard that as a contraindication, and I suspect that it's almost certainly fine for you to go. I can't think of any reason, because the only contraindications are those who have severe allergies to vaccines in the past or to any of the ingredients of the current vaccine, and those with who are severely immunocompromised. And people who are anemic are not immunocompromised.
Good to know.
So, yeah. But, however, if you have a severe immune disorder, either from medication, like some chemotherapy drugs can reduce your immunity, or some people have hereditary or acquired immune disorders, they would need to speak to their caregiver, usually their physician, to see if it's safe for them. For some, you can imagine it would be fine. Let's say someone who's finished their chemotherapy a short while ago. And then for others, it's clear that they shouldn't, because maybe they're having, quite a strong chemotherapy and long chemotherapy session at the moment. But there may be some gray areas. So yeah, definitely one should speak to their caregiver to see if they're eligible.
And that's always good advice, right? I mean, if you're uncertain, ask your healthcare provider.
Yes, and I hear lots of hesitation. People who have really quite strong challenges. They're really not someone with severe diabetes, with a history of heart attack or stroke. They'll say, should I get the vaccine? Am I strong enough? And I have to say, well, actually, it's a really good reason for you to get the vaccine, because if you get COVID when you have diabetes and a heart attack or stroke history, you may not do so well. So yes, that's actually a reason for you to get the vaccine. And then I also get questions from people who have what I consider minor issues, like, I have seasonal allergies. I get hay fever in the spring. Can I get the vaccine? And the answer is yes, of course you can. That's not a contraindication.
Oh, I appreciate that information. You know what? Here's another one that we're hearing about that's making a buzz in the inbox, Dr. Adams. Have you heard, and maybe you haven't yet, but people are talking about COVID toes and COVID tongues as new symptoms of COVID. Have you heard anything about this yet?
I have heard about this, but I haven't heard a definitive etiology or cause.
Okay.
I'm guessing, and I'm not sure what the evidence is. I'm not sure if this has been proven, but I hear that there are some vascular effects from COVID. People are describing that somehow the virus affects their circulatory system. Like you have quite small blood vessels in your toes and in your eyes, perhaps in your tongue, and maybe that's why people are seeing some effects there. But I'm just guessing, and I don't think the medical community has had enough time to be confident about the etiology or the formal cause of those. But we're learning so much about COVID that nothing would surprise me about its effects. We know that it's quite a bad infection, but we don't know the full breadth of it, like how or why it's so catchy and or destructive for certain people.
Dr. Adams, so once people get vaccinated, are they okay to gather? People are wondering now that we're picking up some traction on vaccines. If there were a group of individuals who have all had the vaccination, can they gather and not wear a mask? What does that look like if you're vaccinated?
That's a good question. And it's certainly a human instinct, right? That, oh, I've had
Right.
my first vaccination. Do I get some freedoms now, please? And we're still talking together as, say, chief medical health officers and public health officials and the like to see, what's safe. I know here in BC, my homelands are in British Columbia.
Yeah.
We eased some of the restrictions for people who are fully vaccinated. That there's a suggestion that they could gather, say, in groups of 10 or less, which is a little bit more than if you're unvaccinated. And I know the Center for Disease Control in Atlanta and the World Health Organization, they're talking about, well, what kind of freedoms can we give to people who are partially vaccinated or fully vaccinated that unvaccinated people won't have, because people want certain freedoms. And also, we've really kind of hurt people's educations and workplaces. Like those places are quite severely affected. So is there any way at all that we could loosen some of those restrictions and help people get back to a more, not normal, but a little more freedom? And because the lack of freedom has had some unintended consequences. So I think we'll have to just wait and see, and it may differ from province to province. Again, the provinces are making some recommendations of their own. Some may say 10 people can gather. Some may say 6. Some might go higher. Some may say if you're vaccinated, you can gather without a mask, and others may say, well, we actually recommend that you keep your mask. Some may comment on visiting while you're outdoors. Others may have recommendations for when you can finally visit indoors. It's just going to evolve and grow over time as more and more of us are vaccinated.
You know what? A question here that somebody sent in is Indigenous Services FNIB tracking COVID-19 reinfections, or is that even a concern?
That is definitely a concern.
Okay.
There have been very few cases of reinfection, someone having COVID twice. It's still so rare that it's remarkable and it's noted. Yeah, because we do know that once you've had COVID, you acquire natural immunity, and we know that natural immunity can last for a while. And we know that there are variants of concern, that there are mutations of the current dominant strain. And we don't know yet how having had one strain versus another strain, like let's say you've had A, what happens to you if you get B? And if you've had B, what happens if you get then C? We don't know that well enough yet. So, gosh, I feel like I'm saying a lot of I don't know yet.
No, not.
We don't know yet. But I've tried to be really honest. I don't want to make things up to you, or I'm trying not to guess. I could be wrong, but I do.
Everyone appreciates that, Dr. Adams. Really, to have this honest, frank conversation among two friends, this is what people want to know. And if we don't know the answers, science will share with us soon, right?
Yes, and that's partly our way, right? Like our way is, you mustn't lie to people. You must be honest. You must be authentic. You must be humble. And I'm really trying to stick to our ways in talking to people about this. Like not give you an overly rosy or an overly pessimistic view, but just the best view I can give.
Did I see on social media that you got vaccinated?
Yes, I got my first vaccine.
That's me clapping. Tell us about the experience. And congratulations. Yeah. I'm so excited for you.
Oh, that's so nice of you. Because I know that one chief was kind of upset, saying, well, I'm glad you got yours. My community hasn't gotten ours yet. And I thought, oh, I I hope that people are happy for each other when their turn comes up to be vaccinated. In BC, we're very lucky. Our provincial health officer and our Minister of Health have been very good about honoring the NACI guidelines, the NACI recommendations that Indigenous people be given priority in vaccination. And in our 200 villages, my community was about number 128, about there in the rollout. And they started with older people. So my parents were vaccinated the week before me. What a relief.
I'm so
Yeah.
excited.
Yeah, and every community has different rules, right?
But because
like
we're
Manitoba,
honoring our governance processes,
yes,
right?
that's right. We're allowed to self-determine. Like a community is allowed to say things like, we will vaccinate older people first, or we'll vaccinate our members first, and then non-members who are resident here will be second. Or they might say employees of the community are eligible for vaccination, or maybe not. Or they may say off-reserve members are going to be vaccinated at the same time as in-community members. Or they may say they'll go on a waiting list. The off-reserve members will be on a waiting list. So it's the rules are different from place to place, and that must be maybe difficult for some people when they say, "Oh, but this village they allowed off-reserve members to be vaccinated, but then in another community they didn't prioritize them." So those are difficult. So anyway, I got my community, and I thanked my community members, all those community workers who made it happen. I was so grateful.
I'm so excited for you. And I want to share with everyone who's listening and watching that every staff member at the First Nations Health Managers Association who has been eligible to get the vaccine has received the vaccine. So excited to see leadership in action. And like you, Dr. Adams, thank you for demonstrating your leadership as a health official, as an Indigenous person, as a physician. We applaud you for just, doing as we speak and not just talking about it, but we're actually rolling up our sleeves. And I have to say, I am so excited because I just got a note that Wabano in Ottawa is 40 years of age and older as of tomorrow. Anyone in the Ottawa area, give public health a phone call, Wabano Health Services. And if you're 40 and over, you can get vaccinated as well. So that's my age group. I'm very excited to be saying that one. So hopefully next week I'll be saying I got vaccinated, and I'll share my experience with you as well. I do want to just do a quick shout out to some of and as Dr. Adams mentioned, it looks very different all across Canada because it is provincially and territorial led. This is one where Indigenous Services Canada is supporting the process, but it's the provinces who are administering. And then they, in turn, will talk with how individual nations want to roll out their campaigns. So it does look differently all across Canada. Keep checking the schedules for when and where those vaccinations occur. I know we have, as mentioned earlier, over 500, I think it's 538 nations, communities that are underway with vaccine clinics. And then, of course, we have Regina, Saskatoon, Winnipeg, Toronto, Ottawa, major cities who are administering vaccine campaigns. And don't forget, all Indigenous populations are a priority. So let's take advantage of being first this once. It's such a privilege to finally be first and to be first with the people who look after us, and that's healthcare leaders and practitioners. So very excited about that. Dr. Adams, any last comment before we wrap up? I've got about a minute.
Well, I wonder how to answer people's hesitancies around the vaccine. Because for some, it's very, very simple. Like, oh, am I going to feel fluey? I don't want to feel fluey afterwards.
And
and
do
for some,
you?
it's, you know, yes, you should expect to feel fluey because that's your body having an immune reaction. That always happens when you get sick. Your body slows down and it puts energy into your immune response, producing white blood cells, giving you a fever because fevers can cook bacteria and viruses, force you to rest, you know, make you feel tired. So you're resting instead of going out and running a marathon and spending your energy somewhere else. You know, you should expect. So some people, like I heard a young man say to me, I had the vaccine and my body didn't like it. I felt sick. You know, I felt a little bit sick afterwards. And I had to say, no, that's not quite right. I think maybe your body loved it because it had some help producing antibodies to natural infections. A better way to think of it is, you know, your body was responding. Anyway, I do hope that we can find a way to address people's concerns and encourage people to be vaccinated so that they can protect their nation.
I muted myself. I'm sorry. It's a gong show. I apologize. We're going to continue this dialogue. So please continue to stay tuning in. And if you have questions about vaccines or COVID-19, get them into FNHMA at ihtoday.ca. So a quick thank you to Micmac Maliseet Native News, The Wolf 95.7 Nation News, Element FM, and CIFM in Winnipeg, Eagle Feather News, Alberta Native News, CJWE, CFW, ECKLB, Co-op Radio, APTN. We love you. FNHMA, of course, on our Facebook, Anishinaabeg Nation. And you can check for rebroadcast on your local radio stations. So please do so. And don't forget to join us next week. It's our last one before we take a little break in April. And we're welcoming back Dr. Carol Hopkins, Dr. Brenda Rustuli, and our partners at Indigenous Services Canada. So until next week, stay safe, stay calm, and be kind to everybody. Thanks for tuning in. Hi.